Cardiac arrest is a life-threatening emergency that happens when the heart suddenly stops beating, which prevents blood from flowing to vital organs like your brain and lungs. This is different from a heart attack, where blood flow to the heart is blocked, but the heart continues to beat. In a cardiac arrest, there is a problem with the heart's electrical system, which disrupts its normal beating rhythm. When this happens, the heart can no longer pump blood, and the person collapses almost instantly. Without immediate treatment, cardiac arrest is fatal within minutes. This condition is often called the silent killer because it can strike without warning, affecting individuals who appear healthy and have no history of heart disease. It is responsible for roughly 15 to 20% of all deaths worldwide, claiming approximately 350,000 lives in the United States alone each year. The key to survival here is rapid medical intervention, as the chances of survival decrease by 7 to 10% for every minute that passes without CPR or defibrillation. That shows why it's very important to be aware of its early signs, as they could literally be life-saving. Types of cardiac arrest. Cardiac arrest is primarily classified based on the type of abnormal heart rhythm that occurs. Number 1. Ventricular fibrillation. This is the most common and treatable type, which happens when the electrical signals in the ventricles become disorganized and chaotic. Instead of pumping blood efficiently, the heart quivers rapidly, leading to an immediate loss of circulation. Number 2. Ventricular tachycardia. This is a condition where the heart beats too fast, preventing it from properly filling with blood. If left untreated, VT can quickly deteriorate into ventricular fibrillation, leading to sudden cardiac arrest. Number 3. Pulseless electrical activity. In this type, the heart's electrical activity appears normal on an ECG, but the heart fails to pump blood effectively. This condition can be caused by severe blood loss, extreme electrolyte imbalances, or major trauma, and requires immediate medical intervention. Number 4. Asystole. This is the most dangerous type of cardiac arrest, and it is also known as flatline. Here there is no electrical activity in the heart at all. Unlike VF or VT, asystole cannot be treated with defibrillation and has a very low survival rate unless CPR and advanced life support measures are performed immediately. Early signs and symptoms of cardiac arrest. Cardiac arrest in many cases occurs suddenly and without warning. However, in the critical hours or days before cardiac arrest occurs, your body might try to warn you through various subtle signals that are unfortunately easy to miss or dismiss. Most commonly, you might notice yourself becoming unusually short of breath during simple activities like walking upstairs or doing light housework, while chest discomfort might come and go, often feeling like pressure or squeezing rather than sharp pain. These symptoms might be accompanied by heart palpitations, where your heart feels like it's racing, skipping beats, or fluttering in your chest, along with an overwhelming fatigue that doesn't improve no matter how much you rest. Many people also experience unexplained dizziness or lightheadedness, particularly when standing up or changing positions, and these symptoms might occur alongside nausea and vomiting that could be mistaken for digestive problems. Cold sweats might also develop unexpectedly, often paired with an inexplicable feeling of anxiety or a sense that something just isn't right, what many describe as a feeling of impending doom. When cardiac arrest actually happens, the symptoms are sudden and dramatic. The immediate signs include sudden collapse and loss of consciousness. The person will fall to the ground and won't respond to voice or touch. There's no pulse when you check major arteries like the carotid in the neck because the heart has stopped beating. Unlike a normal fainting episode where blood circulation continues, cardiac arrest completely stops the flow of blood to the brain and other vital organs, making immediate intervention necessary. The skin typically becomes pale or bluish due to lack of oxygen. Abnormal or gasping breaths, known as agonal respirations, may occur in the first few minutes of cardiac arrest. These gasps are often mistaken for normal breathing, but they are a sign that the brain is struggling due to lack of oxygen. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of cardiac arrest. The most common underlying cause is coronary artery disease, where the arteries supplying blood to your heart become narrowed and hardened over time. When these arteries get clogged with plaque, they can't deliver enough oxygen to your heart muscle, making it vulnerable to electrical disturbances. This problem often develops silently over years, influenced by factors like high blood pressure, high cholesterol, smoking, and diabetes. Previous heart attacks play a crucial role too. When a heart attack occurs, it leaves behind scarred tissue that can interfere with electrical signals, much like a broken wire in an electrical circuit. These scars create barriers where electrical signals can get trapped or redirected, potentially triggering dangerous heart rhythms that can lead to cardiac arrest. Physical and emotional stress can act as powerful triggers, especially in people with underlying heart conditions. Intense physical exertion, severe emotional shock, or extreme environmental conditions like very hot or cold temperatures can strain the heart beyond its capacity. Drug use, particularly stimulants like cocaine or methamphetamine, can also throw the heart's rhythm into chaos. Trauma, such as a severe blow to the chest, can also lead to cardiac arrest. This is particularly common in young athletes who experience a blunt force impact to the chest at a critical moment in the cardiac cycle, triggering a fatal arrhythmia known as commotio cordis. Diagnosis of cardiac arrest. Cardiac arrest is diagnosed immediately based on clinical signs, as there is no time for lengthy tests during an emergency. The most common signs are that someone has collapsed, isn't breathing normally, and has no pulse. Once the person reaches a hospital after they survive the initial event, emergency medical teams confirm cardiac arrest using electrocardiogram monitoring, which reveals the specific type of arrhythmia causing the event. If the heart shows ventricular fibrillation or ventricular tachycardia, immediate defibrillation is required. Blood tests may be performed after resuscitation to check for electrolyte imbalances, cardiac enzymes, or signs of heart damage. Imaging tests such as echocardiograms and coronary angiograms may also be used later to identify underlying heart disease or structural abnormalities that contributed to the cardiac arrest. Treatment for cardiac arrest. Here are the various treatment approaches for cardiac arrest. Number 1. Cardiopulmonary resuscitation. The first and most important treatment for cardiac arrest is immediate CPR, which helps maintain blood circulation until professional medical help arrives. Chest compressions should be performed hard and fast, pressing down at least 2 inches deep at a rate of 100 to 120 compressions per minute. If possible, rescue breaths should be given every 30 compressions, but hands-only CPR is still effective if mouth-to-mouth breathing is not an option. Number 2. Defibrillation with an automated external defibrillator. The most effective way to restore a normal heartbeat during cardiac arrest is defibrillation, which delivers a controlled electrical shock to the heart. Publicly available AED devices can analyze the heart's rhythm and determine whether a shock is needed. If administered within the first few minutes, defibrillation can dramatically improve survival rates. The earlier defibrillation is performed, the better the chances of survival. This is why many public places now have AEDs available. Number 3. Advanced airway management. Once emergency medical services arrive, they begin advanced cardiac life support. Paramedics or doctors insert a breathing tube, endotracheal tube, or use a supraglottic airway to ensure oxygen reaches the lungs. This replaces mouth-to-mouth breathing and allows precise control of ventilation, especially if the arrest was caused by respiratory failure. Number 4. Medications. Some drugs are given to stabilize the heart and support circulation. Epinephrine, or adrenaline, is given every 3 to 5 minutes to constrict blood vessels and improve blood flow to the heart and brain. Amiodarone or lidocaine also helps control stubborn arrhythmias. For electrolyte imbalances, intravenous magnesium or calcium is administered. Number 5. Post-resuscitation care. If the person's heart starts beating again, they'll need intensive care hospital treatment. This often includes therapeutic hypothermia, where the body temperature is lowered to reduce brain damage. Blood pressure support with medications, mechanical ventilation, and careful monitoring of organ function are crucial. The medical team works to identify and treat whatever caused the cardiac arrest. At the end, Cardiac arrest is a critical medical emergency where immediate action can mean the difference between life and death. So, any symptoms that might signal an impending cardiac arrest require immediate medical attention. These include chest pain, unexplained shortness of breath, heart palpitations, or fainting. If you witness someone collapse and become unresponsive, call emergency services immediately and begin CPR if you know how. Remember, in cardiac arrest, every minute without treatment reduces the chance of survival. Now, we want to hear from you. Have you or someone you know ever experienced a cardiac arrest? What was the experience like, and what played the biggest role in survival or recovery? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.